There is no other study that has the really detailed lifestyle, environmental, social, genetic, biological information across 3 generations in the depth that we have here, and all linked up and available for scientists to use. COCO90s is the next generation of the children of the 90s. Jean Golding recruited 14,000 women during their pregnancy in the early 1990s, and they and their families have been followed forward in this longitudinal study up until the present day. So for the last 6 years, we have been recruiting the children of the 90s, so COCO90s. So this really is an incredible multi-generational study. A longitudinal health study is one where we recruit participants at one time point and then we follow them forward and track their health and well-being as it develops. In the case of COCO90s, it's what we would call a pregnancy or birth longitudinal study. So we recruited during pregnancy. We've really intensely followed the pregnant women, their partners and their children, and are now recruiting and following intensively the grandchildren of the original women. Longitudinal health studies are important for the health of the UK and the world because we need to understand how health and diseases develop so we can track people and see how their risk factors change, how their biology changes, what factors influence those, and we can unpick cause and effect because we have that time scale, including in the example of COCO90s, being able to follow health as it gets transmitted across generations and understand the impact of that on populations both now and potentially going forward into the future. Contemporary women who are pregnant have a higher body mass index and higher lipid levels, but they're also less likely to smoke, and they and their partners tend to be more educated than their parents' generation. Their children are born with a higher birth weight and are more likely to be born by caesarean section. They're also more likely to be breastfed. What I'm really excited about going forward is being able to look at how risk factors from the original mothers are transmitted to their children, and then we see outcomes in their offspring. And in particular, I'm interested in how that cross-generational life course can impact on heart disease and type 2 diabetes, and therefore how we can prevent those really important conditions really early on in life and make populations healthier. But other researchers will be interested in mental health, cancer, social well-being, how we can make populations more economically viable as well as healthier. And children of the 90s, COCO90s can contribute to that. It is such a rich resource. COCO90s has been central to Bristol becoming a city of research. It demonstrates how the population in Bristol really are behind research, and we see that not just in children of the 90s, but that's what catalysed it, but in so many other studies that we do here. The huge UK biobank, which was across the United Kingdom and is studying 500,000 adults, had a higher response in Bristol than any other city in the UK. And that says it all. And what we're keen to do is capitalise on that, work with Bristol Council, work with the education and the voluntary sector, as well as health and research, and importantly, work with everybody in Bristol and make this a city where everybody's involved in research, everybody's interested in using that research to make us and then a wider group of people a healthy population. What I really enjoy about it is seeing how the study has developed, how flexible it is in terms of picking up on new technologies, how it brings together a group of really dedicated participants, clinic staff and scientists from such a wide range of disciplines to make this a resource that really does matter and really makes a difference to our understanding of what makes people, families and populations healthy or have diseases.